Hello everyone. I want to talk about our methodology and whether you can see me, have a virtual consultation with me, no matter what. Whole body health assessment is essential for you to optimize your prevention, your anti-aging, your health, your quality longevity, your resolution of conditions, whether internal, external, whatever symptoms you have. If your whole body health is not being assessed by the people, the medical professionals, the health practitioners who are serving you, then you are not being well served. Your genetics are in there assessing that. If they're not looking at a complete, all your symptoms, every organ system, if they're not looking at all your blood work, not just some little panel of a CBC and a chemistry, which is not telling you anything, if they're not looking at your homocysteine and your cholesterols and your triglycerides and and your hormones and your thyroid and your adrenals and your zinc and your vitamin A and on, then, and you're seeing 5 different doctors who are not coordinating the knowledge about you, then you are not being well, in my opinion, nor appropriately served in today's world. If they're not talking about your mitochondria, if they're not talking about prevention, if they're not looking at all the pieces of your puzzle, skin, internal, why do you have those symptoms and what do you do to cure them rather than just treat the symptoms in perpetuity? What do you do to mitigate and moderate your genetics? What do you do to prevent so that you do live and you can work and your brain is good? And if you can't focus, if you don't sleep well, if your hair is falling out, if your bones are theoretically not perfect, then are you doing the right blood tests? Are they looking at your whole body health and causes? If not, then the methodology is flawed. And so when you go to an internist and a gynecologist, yes, you need all these specialists as a referral if you have this or that. Sometimes you need assessments. Am I sending people for their colonoscopies? Am I sending them when appropriate? Because I'm assessing the whole body and what is your age and what do you do to prevent and what do I making sure that you don't have anything that I'm missing. If your physicians are not coordinating it, if you don't have one person that's looking at everything, then you're not being well served. And one of the reasons that we do the videos and one of the reasons that we try to address your skin, your supplementation, is to prevent, to reverse, and to serve you as perfectly as modern medicine, state of the science medicine should serve you in today's world. And that includes what devices, what skin, what should you do for your skin and when, but it starts internally. So that methodology is key, which is why we spend all the time we do trying to teach you so that you know what we know, that you're not being well served with the people who are not coordinating your care. Why do you have this and what do you do about the why to try to cure it? I know this will help. Thank you.